Sorry.
Sphenoid.
Sphenoid.
What's the name of this sinus?
Frontal.
Sinus. What's the name of this concha?
Superior. Medial. Inferior.
Inferior meatus, middle meatus, superior meatus. Show me the sphenoethmoidal recess will be here.
Can you please tip it this way? Show us.
Sphenoethmoidal recess is exactly superior to the superior concha.
Gotcha.
Here you are going to find the maxillary bone anteriorly, the palatine bone posteriorly. Here is the floor of the nasal cavity. Here is the roof of the oral cavity. Here you are going to find the nasopharynx, oropharynx, laryngopharynx. Today I explain for you the structure of the larynx. Here it is a cut edge of which cartilage? Epiglottis. Epiglottis is visible here. Now the epiglottis here is going during the breathing, going down and closing the inlet of the larynx. In the larynx, you are able to find the vestibular fold, the vocal fold. This orange area is going to remember you middle chamber. Here is the vestibule. Here is the infraglotte. So again, epiglotte, inlet of the larynx, laryngopharynx. Here is the vestibular fold, vocal fold, middle chamber, vestibule, and infraglotte. What's the name of this? Trachea.
Oh, okay.
The trachea is here, and continue of the pharynx. Here is the esophagus. Trachea, esophagus. Inside of the trachea, you are able to find the cartilage, and it is a cut edge that belongs to the cricoid cartilage. And give me another moulage. About the left line and right line, how do you think? What do you think? This is the right line or it is the left line?
Right.
How do you find that?
Because there is three lobes.
Two deep fissure, the oblique fissure, the horizontal or transverse fissure.
And no
So
cardiac
the
notch.
yes, and no cardiac notch in the anterior border of the line. Here is the superior lobe, middle lobe, inferior lobe. Diaphragmatic surface or base or inferior surface. Costal surface that the moulage of the rib are going to be found here. And the horizontal fissure is going to find parallel to the fourth rib. And the oblique fissure is going to remember you the sixth rib. Now if I rotate, here is the mediastinal surface, here is the diaphragmatic surface. This picture is, this slide is going to remember you left line, anterior border, and this cardiac notch. What's the name of this?
Lingula.
The lingula. So superior lobe, inferior lobe, and lingula lobe. How many fissure is visible here?
One.
Oblique
Oblique
fissure
fissure.
only oblique fissure. Give me the other moulage. We have so many moulage there.
Yes, here.
Uh-huh.
Got it.
This is going to show you the
Trachea.
trachea, the C or U form of the cartilage, the carina trachea, right bronchus, left bronchus, and here you are going, if I rotate posterior to trachea, I am able to
Esophagus.
show you the esophagus. And if you notice here,
Descending
the
aorta.
descending aorta is going to begin. And here is the arc of the aorta. Give me the other one. It is possible in your exam, I give you this moulage and ask you something about this moulage. The inner layer is easy. Vestibule, middle chamber, vestibular fold, vocal fold, and infraglotte. Okay? Here you are going to look at to leaf-like or leaf shape of the cartilage. What's the name of this cartilage? Epiglottis. Here is the ariepiglottic fold. Ariepiglottic fold with two tubercle. One of the tubercle belong to cuneiform, one of the tubercle belong to the corniculate. If I look at to the lateral view, I'm able to show you the superior laryngeal nerve. The superior laryngeal nerve has the external and the internal. The internal, give me this.
Yeah.
The internal, it is not for this. Okay. If you look at here, it is one of the membrane between the thyroid cartilage and the hyoid bone. What's the name of this fibroelastic membrane? Hyoid membrane.
Ligament.
A foramen is visible here. Which item are passing through this foramen? The superior laryngeal nerve is coming and divided to two branches. Internal branch passing from here, it is a sensory nerve. And the external is coming down to be able to innervate a muscle between the cricoid and the thyroid. Between the cricoid and the thyroid here, we have one muscle. And the external branch of the superior laryngeal nerve is coming to innervate this. But the internal passing through this foramen. This artery we call superior laryngeal artery. It is one of the branch that arises from the superior thyroid artery. Okay? Here we have the lateral thyrohyoid ligament. Here is the median thyrohyoid ligament. In your book, it is possible you find that inside of the lateral thyrohyoid ligament, it is possible we'll be able to find very small cartilage. It is possible inside of this lateral cricothyroid ligament we find some small cartilage. And again, what is the, give me those.
This one she explained.
No. I explain
Ligament.
everything here. Keep your hand. Look at here. What's the name of this cartilage? Epiglottis. What's the name of this fold? Ariepiglottic fold. What's the name of this ligament between the hyoid bone and epiglottis? Hyoepiglottic ligament. What's the name of this ligament between the thyroid and the epiglottis? We call thyroepiglottic ligament. So hyoepiglottic ligament, thyroepiglottic ligament. Do you have any question here?
No.
What's the name of this muscle? Cricothyroid muscle. Cricothyroid muscle in right and left side. These cricothyroid muscles are going to be innervated by the external nerve, external laryngeal nerve. External laryngeal nerve is one of the branch that belong to superior laryngeal nerve. What is the another branch? Internal. The internal passing here, but the external coming down to be able to innervate this muscle. Okay? And also the external innervate this muscle and the inferior constructor of the pharynx. And here some of the muscles are visible. For example, the posterior cricoarachnoid, the posterior cricoarachnoid, it is the only muscle that abducts the vocal fold. Here is the oblique arachnoid, transverse arachnoid, again oblique arachnoid. Okay? If you have any question, you can ask me or you can work by yourself. Repeat.
Okay.